Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Hello, Michelle. I'm excited to get back to recording our videos after the summer break.
Yes. Good morning, Dr. Spiller. And we're going to just jump in head first with a very fun topic, desire discrepancy. So I guess we should first talk about what, and specifically looking at this through an EFT lens, right? So by desire discrepancy, this is the number one reason that people seek sex therapy is that couples have often a different desired amount that they want to have sex. So one person might want to have sex very frequently, and one person might not want to have sex very frequently at all. And on the surface, that can look one way, but when we get into it, especially looking at it through our EFT attachment lens, we learn so much more. And I want to start by just naming how Emily Nagoski describes it's not a sex drive. She calls it a desire style. So I'm going to read this because it's like not implanted all the way in my brain. The 40 years of programming that's like sexual desire is still there. So we're all working on relearning this idea, right? So sexual desire style is not a constant innate drive like hunger or thirst, and rather it's a complex system. This part's really important. It's a complex system. It's not simplistic, right? It's not simplistic like the drives for hunger and thirst. And it's highly sensitive to each individual person and their experiences and the surrounding context, which could be, for us especially, the relationship. How do they feel in the relationship? How does each person move in the relationship? So we want to try to move away from this simplistic idea of sex drive and move towards this idea of desire style. Is there anything you
Yeah,
add?
as you talk about that, Michelle, it just is hitting me how um, compassionate and validating that is. That, I think the problem with this idea of sex drive that's sort of innate and more like hunger and thirst is that when people are experiencing less desire, they feel like something's wrong with them or that they're
Right,
broken. And
right,
we reflect on all the different things that impact desire for sex. It makes so much sense that it's going to vary across a lifetime with different people, based on different experiences. And then there's really, it's fact, it says that if that desire fluctuates, that's actually quite normal. And it
right.
system is adaptive,
Mm.
and trying to keep you safe, right? And trying to meet all your kind of internal needs for safety and emotional regulation, right? Um, so I think it's so important to talk about like where we want to bust the myth of sex drive, and help people think more in terms of, desire as a complex phenomenon.
Right. And you mentioned the person who has a lower desire feeling broken, and the person with a higher desire, if they're also looking at this with that kind of through that simplistic lens, which is our cultural lens, right? That's what's on TV, movies, media, books, everywhere. That's what's drilled into our head. So it's not anyone's fault, right? It's just
Yeah.
this is what we are kind of taught through our culture. But the higher desire person might feel rejected, might feel like, what's wrong with my partner? Why don't they want to be with me? Even though partner can tell them over and over again, it's not you, it's not that I'm not attracted to you. But if that's how the feeling is, okay, it's like a drive and everybody wants this. And so if they don't want it, they must not want me, right? So both people often feel an extraordinary amount of pain.
Yes.
And sometimes that pain can come out towards each other, right? Or they move away from each other, and kind of get stuck in that withdrawal. And so, or they, get stuck in a chase dynamic, like one person's pursuing and one person's moving away. Um, all of them are painful. All of them are painful.
I'm really glad you said that because I've had clients who felt like they were deviant because their desire was stronger than their partners and it could made them feel almost like they were at risk of coercing their partner and it just brought a lot of pain to be somehow, yeah, something wrong with them that they were wanting sex too much. Um,
Right.
so yeah, that's such a good point. And then of course, right, we're going to be talking about you're right, is what you're saying, like what that leads to, in the cycle and in the pattern between the couple as they grapple with these differences, right, as they try to figure out. And then of course, right, we know that our society doesn't always make it easy for people to talk about these things directly or clearly.
No, not usually, it seems like. I mean, I guess if people could talk about it, they're probably not coming to see us. So
Right. Right.
hopefully there's lots of those people out there. We're just not seeing them.
Yeah.
Um, so what makes it hard for us as therapists? And there's lots of things that can be hard. Number one, like you said, we might not have any experience talking about this. We might not have any advanced education. Which we should put a link to Mike and Zoya's training and remind me who is the other one, George Fowler and
Lori Watson. Is that right?
yes, yeah. So there's some EFT advanced
Yeah,
sex
We're
therapy.
in Irwin, I think, also has one. So there's a couple, a few. We'll put those
So,
in the few notes.
yeah, so those are good places to start. So back to what makes it hard. It can be hard for us as therapists to empathize if we've not ever walked in the other person's shoes and maybe, we have like a dynamic in our relationship at home that's not working for us, right? So if we've always had lower desire and, it could be triggering to have this person who has a higher desire, it might be really hard to empathize with them or vice versa. Maybe we have a higher desire, our partner's not, we're feeling rejected at home. And now this lower desire person's here, and we have to try to empathize with them when we've not ever had that experience. Of course, we can because we empathize with people all the time that don't have the same experience as us, and it can be challenging.
Right. I mean, especially, as therapists, we're human beings, and this is a super common problem. And in fact, in our society, sexual abuse or sexual trauma is extremely common also. So, sometimes these things can just really tap into our own pain and make it more challenging. We feel really protective of the person who shares, who we resonate with, and perhaps, right, judgments arise. We are human beings. We can feel really reactive to one partner's manipulativeness or if they're coercive in any way. And we know when the cycle gets going, I mean, people do, they're desperate. They're trying to make something change and happen so they can be, angry and forceful and do all kinds of things to try to, to connect really. Uh,
Right. Or they can withdraw and really shut down and be
yeah.
totally uninterested in being sexual. I mean, both extremes can happen. So if we as therapists are feeling triggered, get support. Reach out to a colleague, reach out for peer supervision or paid supervision. But this is an area where, especially if we don't have a lot of experience, we may need to refer. But if we feel like we can manage it, we just might need that additional support through peer supervision or paid supervision. Um, so what else? It can be easy to get, we kind of talked about this, caught in judgment, judging either partner. It can be easy to get caught in the content, maybe they want to ask. In Emily Nagoski's book, she says, people will ask, like, what's normal? What's normal? What's normal? Everybody wants to know what's normal. How often are most people having sex? And she won't answer the question, which I love. And that's the first thing, when I started doing the sex therapy training, I'm like, what's normal? What's normal, right? Everybody wants to feel normal. Like we want to feel normal, or we want it like that as our guidepost of like, okay, I'm here. This is where I need to get to. And the reason that she doesn't answer the question is it because it keeps people in that judgment of themselves, of their partner, of their sexual relationship, rather than looking at what's going well, what are the blocks to sexual connection of all these other pieces, pain, trust, safety, blah, blah, blah. It keeps people from looking at all of that and just like goal oriented mindset.
Who's right and wrong, right? Yeah,
Right.
right.
Yes.
And I love that
So,
she says it's all normal, and the goal is to enjoy the sex you're having.
yes. What a concept.
Yeah,
Enjoying
yeah,
the
yeah.
sex you're having.
Right, yeah.
It's almost like too simple to be a reasonable goal, right?
Right, right. I think the other, even if we're staying fully kind of embodied in our therapist selves, and we can also be moved into this problem solving fix it mindset, right? Because we see the pain, we want so much to help them. And so we might default to worksheets, assignments, I mean, which are good tools in certain places. But if we default to or jump into those behavioral solutions, again, we may not be helping them in the emotional space or in the process space. Typically, my experience is if I jump too fast to those interventions, I haven't dealt with the blocks, to intimacy and communication that are keeping them from doing those things. So it can be really frustrating for the client and for the therapist. So trying to notice that when we're trying to like, our own urgency to give them some relief, that to sit with that too and feel that and notice that and appreciate it, but maybe not have to move into some of those immediate interventions. I don't know what you think about that if you've seen that too.
Yeah, definitely. I mean, I've been like pulled into the content and wanting to problem solve, and then they come back the next week and it's clear that, yeah, we didn't deal with the emotional block, you know?
Yeah.
And it feels good. It feels so good to have a tool and do this, and then it's going to get
And
better.
stay focused. Here's some really good step-by-step instructions. Go do this, right?
Yeah, and like you said, it's not that there's anything wrong with those tools. It's just that they're not as effective if we haven't dealt with the underlying emotional blocks that are most likely there. And it's human nature. Like our clients aren't going to be like, "Oh, let me lay out all my pain on the table for you to like sift through." We as therapists have to kind of know that there are likely emotional blocks, that there are likely pain points, and that our client needs help finding them,
Yes.
going deeper into them, unpacking them,
Mhm.
making sense of them. And of course, we do that with lots of validation and normalizing. And as you said, when we were preparing for this, we can give psychoeducation similar to how we do in general in EFT, like with affairs or with trauma, we sprinkle it in. So it's not, that's really important too. Like, but it can be sprinkled in while we're making sense of emotion.
Yes. Yes. I mean, yeah. Um, it's part of that validation, right? Yeah. Of course you feel that way. That makes sense given this, blah, blah, blah. And we just drop in those little tidbits. Um,
Right.
so I'm glad you brought that up too, that just, our attachment system, the self of therapist gets activated, both for our, the fact that it is a long path, that it takes some work, that there's that years of pain to unpack for them, and of course we have our own, emotions and attachment system needs that can come up and be present there. And then we've got, cultural scripts
Hmm. Right.
around this.
Yes, yes. Really Painful cultural scripts. One that I hear often is pressure to be sexual regardless of what's happening in the relationship, or even like physical pain that might be that one person might be experiencing during sexual experiences. That there's just so much pressure to be sexual no matter what. Um, so yeah, there is so many different kind of places where there's cultural messages that people might be trying to follow with kind of unknowingly. And so it's helpful for us, one, to have, you know, education around these things and kind of be able to sift out what is what does a healthy sexual relationship or a healthy sexuality individually look like? And then where does the all these overlays of cultural messages get layered on top of that that we can kind of start to unpack and sift through? And then, of course, the relationship dynamics. So I guess if we wanted to move into the strategy, what are our main and this is really just like, you know, first brush stroke, right?
Right.
First couple of brush strokes in working with desire discrepancy in a couple. Um, but what is one of your strategies, Dr. Spiller, that you use?
Well, this is an episode in our sexuality and EFT series. So one of the things I do try to do is really normalize those differences. Talk about responsive desire and spontaneous desire, talk about accelerators and brakes. Um, and I may do that in a little bit bigger chunk, especially when we're starting to track the sexual cycle, just because I think it counteracts some of that cultural programming and scripts and shame and it does help them really have a different perspective on the struggle that they've had. So that's one of the first things I will do. And then, of course, just putting it all in the context of the cycle. What about, well, yeah, well, I really want to know what you would say is your strategy here too.
Yeah, same. Validating. And then I think podcasts are a great way to like give some education. I mean, if they'll read a book, awesome. But podcasts are like little clips, especially if you want to say, you know, you explain responsive desire, but they kind of have that glazed over look, like they've never heard of this before, right? So then you can give them a podcast that you've listened to and trust the information so that they can kind of hear it at home and maybe talk about it. And because you're starting to, you know, they're just learning something for the first time. So it's going to take some information. But then, yes, starting to track the cycle. So help me understand when you, and it when you guys try to talk about your sexual relationship, how does that go? Or when you have a disagreement about in your sexual relationship, or when you have a concern or a sexual experience that doesn't go how you were hoping it would go, or that didn't go at all. What does this look like? How did this go? So we start to track when and where does this happen? So you can, there's kind of two different parts you can track. You can track the sexual experiences themselves, you know, like who's initiating? How do they initiate? How does that go? Is it a positive experience for everyone? As they start to have a sexual experience, how is it going? Is it positive for everyone? When does it start to not feel positive? How do they respond to that? What do they do when things start to go sideways? Do they turn towards each other? Do they turn away? Are they able to communicate about it? Are they not? Um, what happens after a sexual experience, or what happens after a sexual experience that went sideways? How do they respond to this? So tracking the sexual experience at all these different parts and their moves, the behaviors. Is it a turning towards? Is it a turning away? Is it a getting activated? What does that all look like? And then also the the conversations around their sexual relationship. Do they talk about it? Does that go well or not so well? Do both people feel like they can bring it up and talk about stuff? One person more than the other? How does that go? So you're tracking the behaviors in that. And then just like every other And when we track the cycle, we look at their secondary emotions, we look at the thoughts, their perceptions, what are they thinking and feeling? Then we look at their primary emotion. How do you feel when you initiate with your partner and they decline? What happened inside? Were you able to tell them that? What do you do with that pain? On and on and on, right? So we're just like we track the cycle about anything else, we track the cycle about this to try to understand how do they move. And this is, there are different circumstances where it's more nuanced, right? But we can still look at this overall. How are they moving with each other through this? Do they turn towards, away? Do they get activated?
Mhm. I'm just hearing too how you can kind of get the history of the disconnection in that. It's so common to see couples come in once this has been a really established pain point and it's gone on for a long time. And you can see how, you know, when it goes sideways and they don't have good ways to talk about it and the disconnection increases, then of course, right, the difficulty to initiate and connect sexually increases. And then I mean, it just spirals up. And sometimes that can help them to see that, how
Hmm.
it kind of fed into each other. In the same, and to develop some more compassion for one another.
Yeah. Yeah, for sure. And themselves, right? And absolutely. I mean, by the time that they see us, usually there is a history and it did not always look the way it looks right now. It like went through all these different periods of time. And that is like comforting to look back and see, oh, this is how we got here. Like there's a reason that we got to this really stuck place. And also when they learn that they're not alone, that these experiences are normal for couples, that lots of couples struggle in similar ways, that can be very validating and normalizing as well. And something that we didn't specifically talk about that I think is worth naming is avoiding mislabeling. So, the lower desire person might be mislabeled as withholding or broken. The higher desire person might be labeled as demanding or objectifying.
Mhm.
And similar when you think about a pursuer withdrawer and how if nothing to do with the sexual cycle, when people don't know about attachment theory, they would be like, oh, well, you're a this, that, and the other, and you're clearly this, that, and the other. And, it's easy to apply
Yeah.
all these labels, which are maybe true to some extent, but they're just not helpful because they don't help people feel understood. They don't help people figure out why they're doing those things or change those. Or, like George Fowler said, there's always a good reason. We just have to be curious about what that is. And I think, especially in sexual relationships, it can be easy to mislabel. So, in wrapping up here, like this is where we acknowledge we are just skimming the surface of a really big, complex topic, but we just want to give you a little kind of a starting place. Um, yeah, I'm wondering, is there anything that you, Dr. Spiller, would say, okay, now you have this information, maybe you can try this before your next session, or where did you kind of start when you first learned about this?
I think, yeah, like you mentioned earlier, being able to do a training from the EFT perspective on how to, help couples with sexual disconnection is important. I love your idea of the podcast too, and I think we should drop some of those in the show notes also that you might share with clients. Um, because the more we can have a map for our work, the less kind of caught off balance we are. Um, and I guess the other thing is just to, again, um, understand that this is challenging for us, for all therapists. And, if you feel a little bit off in session, take some deep breaths and kind of ground yourself. And, you are awesome if you feel discomfort or, any emotional dysregulation, that's coming from your care also, right? That's coming from your desire to help this couple. That's coming from your, desire to care for yourself. So I think, or your client, and it's again so normal. So just giving yourself permission, even in session, maybe to take a few deep breaths and say, remind yourself that you've got strategies to help them, that actually leaning into their pain and helping them see how they've gotten stuck and how it is rooted in their desire for connection will be helpful. If you
Yeah, I love that last part that you said that just like no matter what topic we're talking about in EFT, we move in towards the pain, we try to understand it, we try to make sense of it. And of course there's going to be pain when there's disconnection. And of course they're going to be doing things that they don't want to be doing that aren't necessarily working for them, right? So and when you look at it like that, it's like, oh, okay. I know how to do this. It's just with this new topic. And that can throw us off balance when we're kind of, like affairs or any other big topic that's kind of big and heavy. Yeah, it can throw us off balance and we can find our balance again. So, yeah, I don't remember what's next in our series, so it'll be a surprise.
Yeah. I was just thinking that we might do like a case study something like that might be fun because I think that one of the things that was coming up for me is sometimes having the language around how do we reflect the attachment meaning and that
Hmm.
good intent in these moves. Sometimes it can be really helpful to have some phrases uh,
Yes, that's
there.
a great
So
idea.
that I think that might be a good thing for us to do. So.
Yeah, ways that we
If you're listening to this, please note, drop in the comments, any follow-ups or questions you have. That always helps us plan what to talk about. So we appreciate those comments.
Yes, they are very helpful and encouraging.
Exactly. Yeah, we're newly inspired to as we kick off our fall schedules to make sure we keep recording these. We appreciate your comments.
Yeah. All right. Well, thank you, everybody.
All right.
Bye.